We are observing World Stroke Day on October 29th to increase the awareness about this catastrophic illness. It's a lifestyle disease and it's the most common cause of death among Asians. And for more importance, the young strokes are very common in Asians. The percentage of young people less than 45 years getting stroke in Asians is about 15 to 20%. This is an alarming fact. So how are the stroke symptoms appearing? We know there is loss of speech, weakness of one side, difficulty to balance, and double vision. These are the symptoms of strokes. So what are the causes of stroke? We have many risk factors of stroke, and the most important risk factor is high blood pressure and diabetes. So high blood pressure is the core risk factor for stroke, and it can result in different types of stroke. We have two types of stroke. That is, the blood vessel will rupture causing hemorrhage called bleed, and the blood vessel get blocked called ischemic stroke. The hypertension can result in these two types of stroke. Let us see how hypertension results in these type of strokes. One thing, when blood pressure is uncontrolled for a long time, there could be dilated areas in the blood vessel, small blood vessels of the brain, and these dilated areas are known as Charcot-Bouchier aneurysms, and this can rupture, resulting in torrential bleed inside the brain. That is called bleed. So how hypertension is causing block type of strokes or ischemic strokes? The ischemic strokes are caused by two mechanisms. One problem is long-standing uncontrolled hypertension will result in heart disease. So what are the heart diseases it can be causing? One is the heart failure, and reduced pumping of the heart can result in clot formation in the heart, which will be pumped to the brain. That is called embolic stroke. Other thing is, patients can develop something called atrial fibrillation, or the rhythm change of the heart, resulting in clot formation in the heart. So in this way, long-standing high blood pressure can result in stroke due to several heart problems. Apart from that, the long-standing hypertension can result in changes in the blood vessels of the brain. Smaller blood vessels get slowly occluded. The smaller blood vessels in the brain get slowly thickened inside their vessel wall, and ultimately they get completely blocked, resulting in a small stroke called a lacunar stroke. And otherwise, they can also result in large vessel blockage in long-standing atherosclerotic process. So hypertension also causes blocks of large vessels due to a process called atherosclerosis. So these are the mechanisms how high blood pressure is causing stroke. So it is vital to prevent stroke. We have to control the blood pressure by reducing salt, by doing regular exercise, having a very good healthy diet. So now comes the second risk factor called diabetes. Diabetes, we all know, India is going to be the diabetic capital of the world. There are a large number of people with diabetes. Diabetes is also a significant risk factor for stroke. How diabetes will cause stroke? One thing, the long-standing uncontrolled diabetes will result in thickness of the small vessels in the brain. So that is called small artery disease. So these small arteries get blocked, resulting in lacunar stroke, just like hypertension. So that is one of the methods how diabetes will cause stroke. And otherwise, diabetes can result in the large artery atherosclerosis process because of the uncontrolled diabetes. So this also will result in stroke. And it is also found that people with uncontrolled diabetes had high risk of intracerebral bleed or the hemorrhagic type of stroke. So in one way, if the patient is having stroke and diabetes, the risk of stroke is high, and the stroke happened in the diabetic patient, the prognosis is bad because the high blood sugar will result in complications of stroke. And that's why we have to control diabetes also to reduce the incidence of stroke. So these are the two major causes of stroke. We have to control diabetes, we have to control the complications of diabetes, we have to control the high blood pressure for sure to reduce the incidence of stroke. We have to prevent stroke so that we can have less disability and we can have a better society from reducing the stroke. Thank you.